morning, Dr. Lee.
Adam. I'd like you all to meet Adam Benjamin.
Oh.
Tasha.
Hi,
Chris.
Tasha. Chris.
Hi, I'm Laura.
Hi, Laura.
And Emil Wood.
Hi, Laura.
I promised them that you would show them your sheep heart demonstration if you would. They're here to learn about the human heart.
Sounds good. If you guys will follow me, we'll get started.
Bye, Dr. Ray.
Bye,
Bye, thank you.
Nice visiting with you.
Bye.
Hey, guys, if you all follow me down here, you guys have a seat in this front row for me. All right, good morning, everybody. Welcome to the McGovern Theater. We're going to be here this morning for a sheep heart dissection demonstration. Now, let me explain to you guys what that means. When we dissect something, what we do is we take it apart so that you can see what it looks like on the inside. And today we're going to be doing that with the real sheep's heart. The reason we're using a sheep's heart is the parts of the sheep's heart are similar to the parts of a human heart. It's just much easier to get a sheep's heart to try this with and a little more difficult to try and find a human heart to try it with. Now, there will be no blood involved in our dissection, so it shouldn't make you guys feel queasy. But if it does tend to make you feel a little bit uncomfortable, for your convenience, we do have restrooms located right outside of those doors there. Now, the first thing we want to do is we want to establish where your heart is located. Your heart's in the center of your chest, a little bit to the left, and the heart is about the size of your fist with your other hand wrapped around it. Your heart is a muscular pump that pushes blood throughout the entire body, from head to toe into your lungs. Let's take a look at this sheep's heart. Here we have our sheep's heart. What we're looking at here is the ventral surface of the heart. That also means the stomach side. So if you were to open up my chest, this is the view that you would receive of the heart. Towards the back, we have the dorsal or back view of the heart. Now, there is a way we can tell the difference between the two. We can tell the difference between the two by locating what we call the coronary blood vessels. The coronary blood vessels are the blood vessels that go around the heart. Yes?
What is that white stuff on there?
Interesting question. The white stuff that you see here, these are actually layers of fat. Now, it is normal to have a little bit of fat on the heart. You shouldn't have too much fat. On a human heart, we probably find a little less fat than this because humans, for the most part, were fairly active. We rollerblade, we swim, we ride bicycles. Whereas sheep, on the other hand, I've never seen a sheep rollerblading or swimming or doing any gymnastics. Basically, all they do is stand around and eat all day. So we expect to find a little bit more fat on a sheep's heart than a human heart. And the fat actually protects and covers some of those coronary blood vessels. Here's one of them here. And here's a second coronary blood vessel. If you see these coronary blood vessels form the capital letter T, here's a horizontal portion of it. There's a vertical portion. Then you're looking at the dorsal or the back surface of the heart. However, if those coronary blood vessels form what we here at the museum nickname the raceway stripe, moving from the upper right-hand part of the heart down to the lower left, from the upper left-hand part of the heart down to the lower right, then you're looking at the ventral or stomach surface of the heart. There are also some flaps on this heart, and we nickname these flaps dog ear flaps. The real name for these dog ear flaps are auricles. And here we have one auricle or dog ear flap, and on the other side of the heart we have one auricle or a dog ear flap. These auricles are attached to the atria or the receiving chambers of your heart. As you probably know, your heart has 4 chambers, 2 at the top, 2 at the bottom. The 2 chambers at the top are called the atria. There's one on the right side and one on the left side. The 2 chambers at the bottom are called the ventricles, one on the right and one on the left. Yes?
Could you eat a sheep's heart since you can eat chicken heart?
That's another good question. You definitely can eat a sheep's heart. You probably wouldn't want to eat this one because it's in a preservative or a chemical that keeps the heart from turning rotten. But a normal fresh heart you would be able to. Now we're going to look at some of the blood vessels on the heart. These 2 large blood vessels that you see at the top, these lead to the aorta, or the largest blood vessel in the entire human body. What the aorta does is it takes blood from the lower chamber of your heart, known as the left ventricle, and sends it from head to toe to all parts of your body. This vessel here, this is known as the pulmonary artery. The pulmonary artery takes blood away from the heart and into the lungs. When blood returns from the lungs, blood enters through in the human heart, there'd be usually 4 vessels that you can find. But on the sheep's heart, usually because of the way the heart is removed from the animal, there's only one large hole left on the back side of the left atrium. And these are commonly called the pulmonary veins. Now, instead of splitting this heart open right side to left side, we're going to divide this heart into a front half and a back half, what we call a dorsal surface and a ventral surface. Our first cut is going to start in the superior vena cava. The superior vena cava brings blood from the head and the arms into the heart. And we're going to move down along the right side of the heart. To the apex. This is what we call the apex, the bottom point of the heart. Then the second cut on our heart is going to move down the left side of the heart, and it's going to begin in the pulmonary vein.
Pretty cool.
Now, one of the first things we need to identify in the heart are the valves of the heart. And when we talk about a valve, I want you to think of a valve as a doorway. That is something that lets blood into or out of a chamber inside the heart. And the human heart has 4 valves. This valve that we're looking at, this is known as the tricuspid valve. Now let me ask you guys this. Who thinks they can tell me how many pieces the tricuspid valve is made up of?
3.
3, there you go, just like a tricycle has 3 wheels. Here is one of the 3 flaps of the tricuspid valve. Here is a second of the 3 flaps of the tricuspid valve. And then we've actually cut directly through the 3rd flap of the tricuspid valve. And the stringy things that you see in here, these are known as Chordae Tendonae. They're attached to a valve at one end, and towards the other end, they're attached to lumps of muscle. We call these lumps of muscle papillary muscle. The papillary muscle pulls on the Chordae Tendonae, which pulls on the valve and causes it to open and close. It also prevents the valve from opening in the opposite direction. Now we're going to take a look on the other side of the heart. On the other side of the heart, instead of finding the tricuspid valve, we're going to find what we call the bicuspid valve. How many pieces do you think the bicuspid valve is made up of?
2.
2, just like a bicycle has 2 wheels. Here is one flap of the bicuspid valve. And the second flap has been cut through as well. There's a portion of it here. There's a portion of it here, and another portion of it right here. You can also see the Chordae Tendonae, and you can also see that papillary muscle a little better. The left side of your heart tends to be a little bit stronger than the right side of your heart. The right side of the heart pumps blood to your lungs, which are very close. They're on both sides of your heart. Whereas the left side of the heart pumps blood from head to toe, which has a lot to do with why the left side of the heart is a little bit stronger than the right. At this point, we're going to cut through the septum. The septum is that wall in the center of the heart. Notice you can't see through the heart. That's because of the septum, or that wall that divides the heart into a right half and a left half. Now we're going to complete cutting this heart in half. Now with this heart cut in halves, we can see the inside of the heart completely. And I'm going to see how well you guys were listening. Who thinks they can identify the right half of the heart and the left half? Remember, this half of the heart has a right and left side, as does this half of the heart.
Okay.
I remember
Who remembers the biggest hint from the difference between the right side of the heart versus the
left
left
side.
side?
Left side is stronger, so I think the right on the left piece of meat would be the stronger half because it looks like it has more muscle.
Okay, that is correct. On this half of the heart, this is the left half, and on this half of the heart, this is the left side. Notice the difference in thickness of the muscle wall on the left side of the heart versus the right side of the heart, okay? And then here we have the septum, or that wall that divides the heart into 2 separate halves. You guys have any additional questions you'd like to ask?
No, sir.
Nope.
Okay, well, that sounds good. If you have no further questions, what I'm going to do is I'm going to invite you guys to come up and take a closer look at anything that you might not have been able to see clearly from your seats. Thank you guys for coming out to our dissection this morning.
You have to put on gloves.
Go ahead. I want to.
You're a real
say
girl.
goodbye.
Let's.
Oh, I got gloves on. You just cutting off everything, aren't you?
I want to cut off a piece of fat.
We have to have an exploration.
You have some. That's really gross. That fat, like.
I'm
having a heart attack.
That's the one where it actually comes in and out of the pumping chambers, okay? The coronary vessels are the ones that actually take the blood to the heart muscle itself. Remember, the heart's got to have its own blood supply besides being pumped.
This is pretty cool. Tasty.
Well,
Don't cut me.
to prevent heart attacks.
Ew.
you have-
Wash my hands.
You almost cut